Let's start by discussing the key radiological findings in this case. The radiographs show frontal and lateral views of the whole spine, and from the get-go, multiple abnormalities stand out. Focusing on the spine first, there's a focal kyphosis centered on the thoracolumbar spine, with loss of anterior height and beaking of the upper lumbar vertebrae, clearly visible on the lateral view. This kind of kyphosis, combined with the exaggerated sacral lordosis and posterior scalloping of the vertebral bodies, particularly on the lateral view, is significant. Next, on the frontal view, we observe progressive narrowing of the interpedicular distance in the lumbar spine from cranial to caudal levels. That narrowing is a classic finding that we need to pay attention to in cases like this. Moving down to the pelvis, the iliac wings are squared off and the acetabula are horizontal, leading to what is commonly referred to as the champagne glass-shaped pelvic inlet. These skeletal changes are hallmarks of a dysplasia. Additionally, the proximal humerus shows metaphyseal flaring, another distinctive finding in skeletal dysplasia, and taken together, these findings point us towards a diagnosis of achondroplasia. Achondroplasia is the most common form of dwarfism, presenting with these exact classic skeletal features, including rhizomelic shortening and narrowing of the spinal canal. Now, you might anticipate some questions coming your way, so let's cover those. One question could be about the cause of posterior vertebral scalloping. While it's commonly seen in half the population as a normal variant, in this case, it could be linked to raised intraspinal pressure secondary to spinal canal stenosis, which is a known complication in achondroplasia due to the narrowing of the canal. Another common question might be, what are the complications associated with achondroplasia? Neurological complications are indeed frequent, particularly spinal canal stenosis, which can lead to cord compression. In terms of further management, you'd expect the examiners to ask how you would monitor this patient. It's important to highlight the need for clinical and radiological follow-up, specifically watching for signs of increasing spinal canal stenosis or neurological symptoms. Before we conclude, let's take a moment to reflect. Achondroplasia presents with very characteristic findings, but it's important to always correlate with clinical history and to be aware of potential complications. If you found this discussion helpful, don't forget to subscribe to Radiology Made Easy. We're constantly breaking down cases like this, helping you master radiology. And if you have any thoughts or questions, drop a comment below. Let's keep the learning going together.